I want to get your reaction to this new law. First, as a guy heading up a big medical center, the second as a clinician, as a physician. Let's start with your current role. What do you make of what this law has in it?
Well, we're really concerned. I think, first of all, you have to start and see what who pays for health insurance. And really, there are four different payers for health insurance. There's the employer who pays for health insurance, and that's about 170 million people in the United States, about half, less than half. And then you've got Medicare, and neither one of those are getting changed in a major way. The ones that are getting changed is Medicaid, and then those people who have supplements to their insurance policy for the individual insurance. So the real discussion revolves around those last two. And Medicaid particularly. Medicaid is now jumped up to about 70 million people across the United States, or 1 in 5 people in the United States are being covered by Medicaid, and it has grown enormously. And that's where the major extension of the Affordable Care Act has gone, is by adding people, about 15 million, to the Medicaid ranks. And that's being changed in a major way, particularly in 2020. So we're concerned, frankly, that it's going to adversely affect the number of people who are getting covered in their insurance, and also, the extent to which they'll be covered.
As a physician, do these changes make sense to you? Are physicians concerned about the way that healthcare is being funded right now?
I think we're both. I think we're concerned about the changes because there's been a big improvement in the number of people who are being covered, and so people who used to have charity care, now we get something for. It doesn't cover their total cost, but we get about 75% of what it costs us to provide the care. But if we have a major change, we think it's going to get more that don't have any coverage. Now, the implications of this go across the hospital system, because right now 52% of the hospitals in 2016 essentially did not make any money. So they're heading on a very tenuous financial situation, and if you begin to take away the coverage for a lot of the care that they provide, then they're going to be in deeper financial trouble.
How has your bottom line at the Cleveland Clinic changed since Obamacare, since the Affordable Care Act was put into place?
Well, what we did that really, we thought that we needed to begin to take costs out. We've taken about, on an $8 billion budget, we've taken about $700 million out of costs, which helped us enormously. Had we not done that, it would have come down substantially. Our margin was about 2.5% last year.
Changing this law, changing the Affordable Care Act, repealing it, replacing it, repairing it, whatever the word, is clearly very important to this administration. It's happening very quickly. Are you worried about the speed with which this is happening, that there isn't enough thoughtfulness going into this?
Yeah, I think that this is something that affects everybody in the United States. It's the biggest industry in the United States, and I think it's going to take a lot of thought and a lot of input, because there's a tremendous number of sectors that are involved with this. When you deal with the biggest industry in the United States, it affects employment, it affects people's health, it affects the insurance industry, it affects almost every aspect of healthcare and the citizens of the United States, and I think it's going to take some time to figure it all out in a logical way.
What do you say to those who are calling for all-out repeal of this thing? Get rid of the Obamacare, Affordable Care Act. Is that possible at this point, or is the horse out of the barn?
I doubt that we're going to have total repeal. I think what we're talking about more is about repair. You've seen already that the proposals keep a bunch of the issues like pre-existing conditions and not being able to deny for that, keeping people on your parents' programs through 26. The popular aspects of this are going to stay in place, and so I don't think you're going to completely wipe it out. I think you're going to see modifications of it over time.